Our guest is Dr. Lee Sheldon. He's a noted area periodontist. He is Solid Bite Dental. He works with a great bunch of experts, Dr. Michelle Furtado, who is also an expert periodontist, and also his own son, one of the top 40 dentists under 40 in the country. Dr. Matt Sheldon is part of the practice. And the last time Dr. Sheldon was on the radio with us, we had this topic about calculus. And at first I thought it was a math question, but quickly figured out, no, he's talking about teeth. And again, we're going to be talking about teeth today, but more importantly, we want to give you some insight into why calculus, and particularly fractured calculus, can be so dangerous. So with that, Dr. Lee Sheldon, welcome to the radio. How are you, sir?
Hi, Kerry. Great. How are you? It's good to be with you again.
Oh, it's a beautiful day here in Florida, and we're just enjoying it here in the radio studios, and always good to talk things that are valuable for seniors. And so this topic was really interesting because I have followed over the years. You've done so many TV shows with Joe and radio shows and articles, and you have really been effective at communicating the fact that good mouth health is so important to overall health. And I think that's kind of where this is leading us today, right?
It is. Last time we talked about this problem of calculus, so let's just recap. And by the way, you did a great recap for me, so I don't have to do very much. The problem of calculus, which is a hardened bacteria that's stuck below the gum line, which causes ultimately the loss of bone support. And when bone support is lost, that's called periodontal disease. And of course, if you lose too much bone support, the tooth gets loose and comes out. So the initial stage of that includes plaque and then calculus. Plaque is something that you remove with a toothbrush and floss and other aids. Calculus is what the hygienist removes. And when there's calculus below the gum line, the article that had come out, which is receiving quite a bit of attention, a lot more over the past month since we talked last, I'm talking about nationwide attention, is the fact that when calculus comes off, when the scraping is done, which is called root planing, that the first thing that happens is the calculus fractures. In other words, the calculus doesn't cleanly come off the root. And it's the fractured calculus that remains that becomes a significant health problem, not just a problem with regard to the teeth, but a general health problem as well. The problems that we're seeing in practice are that the fractured calculus remains, and last time we talked about the fractured calculus acts just like removing part of the calculus isn't enough, so we've got to remove all of it in order to be able to solve the problem of periodontal disease. And when that doesn't occur, then the periodontal disease continues. Well, there's more to it than that. And I can, by the way, Kerry, I'm hearing you very well today.
Oh,
so
good.
if you have a question, I'll probably hear you asking the question. I don't think I'll step over your questions today.
Oh, good. Yeah, because you had sent me over some notes, and I was reading these with great interest, and you were talking about this concept of fractured calculus. You said it has holes in it, like Swiss cheese with them, and it has a name, but you said this is actually where maybe kind of like the ultimate challenge lies, because you said this really got my attention. You said essentially there's a direct line from the bacteria filling those holes through the ulcer into your bloodstream, and then you go into some of the things which really sound scary about what could happen from there.
Yeah, it's absolutely true. When you have calculus below the gum line, and then whether you fracture it or not, if the calculus is there, or if you fracture it and expose the calculus now to the outside environment, then things happen. Now, understand that when you've got a disease, a gum disease, your gums are sore. And by the way, you may not feel the gum as being sore because the disease is so deeply below the gum line.
Wow.
But on the inside of the gum tissue, that gum tissue is ulcerated. So imagine this. You take off the calculus. You remove the calculus and it fractures. And now, as you say, there's Swiss cheese holes. It's called lacunae, Lacunae. Lacunae, which are spaces or Swiss cheese holes within the calculus that have tons of bacteria, millions and millions of bacteria within them. And now this bacteria is exposed directly to the ulcerated gum tissue underneath the area of the gum tissue that you can feel. So now we have a direct line from the bacteria within the lacunae, the bacteria within those spaces, now it goes directly into your bloodstream.
That sounds terrible, actually.
Well, I think if over the past several years, we've, and this has become common knowledge now, I'm sure our listeners know this, is that it isn't just periodontal disease that causes tooth loss, which is bad enough. It's periodontal disease and the periodontal disease bacteria and their association with other diseases. So, and I'm talking about diseases not having to do anything within the mouth. So, for example, there's a bacteria, it has a big name, I'll say it just so I can say it, Hormone gingivalis.
I'm glad you said that. I was reading this on the piece of paper. I don't even know where to begin with that one, but boy, when you talk about the challenges that one creates, wow.
Well, it's true because, when we see our patients, it isn't just we're probing and we're seeing what the pocket depth is. As you know, we've discussed it with you and with Joe as well, that we do a test to determine what the bacteria is so we know what we're treating and know what we need to do in order to be able to treat it most effectively. Hormone gingivalis, or better known, easier said, PG, if you will, not parental guidance, PG. It's big because, particularly when we're talking about, particularly to this audience, this bacteria is associated with strokes, with Alzheimer's disease, with dementia,
wow,
with cardiovascular disease, and atherosclerosis. I mean, so it's a biggie. It's a biggie. And so when we told the story once before that as bacteria is discovered in the mouth, and as we look at its association with overall health, we see that there's definitely an association between that and overall disease. So yeah, it's a biggie. So imagine you clean off the calculus, you fracture it, you now have these open spaces with Hormone gingivalis just coming out of it, going right through an ulcer and going right into the bloodstream. And the results are, or at least the association is, there's is all of these other diseases. And it isn't just this bacteria. In the article that we'll see in Senior Scene magazine next month, I've covered 3 of the bacteria. There are others that are linked to pancreatic and esophageal cancer. There's another one that's associated with the onset of symptoms of rheumatoid arthritis. So the mouth is obviously, and maybe not so obviously, but the mouth is associated and perhaps in some areas causative with other diseases that are present. They're very devastating diseases.
And this is really the point, I think, that you have been careful to bring out, all along the way. And I want to remind listeners, if you're like me, you may be a little bit shocked and horrified to be hearing this, but it's important that you have this kind of information so that you understand that you can be ahead of the curve and be working on this, because this is the kind of research and things that Dr. Sheldon is always doing and trying to keep us up to date on things we need to be aware of. But I guess the thing that I want to point out is there's a lot of TV shows and radio shows. We archive everything. I mean, the TV, the radio, the articles that you've contributed into the Helping Seniors newsletter, which publishes center section in the Helping Seniors magazine. All those are archived on helpingseniors.brevard.org. But I guess a recurring theme that you always talk about, Dr. Sheldon, is that what is happening in your mouth really can create issues elsewhere in the body, and that we have to look at that if we're going to be concerned with really being as healthy as we can.
It is. And, the question might be, well, maybe my doctor will tell me about that. And the answer is, when physicians go to school, they learn nearly nothing about what goes on in the mouth. And so if they're reading it in some of the literature that we're reading it in, still, there's not much they can do about it unless they're referring you to a dentist or somebody who's good at treating periodontal disease. And, of course, that's my specialty.
Right.
In order to be able to help this. And we're not saying this is the only cause of anything. It isn't, solve your mouth problem and everything else is going to go away too. No, I mean, that's not what we're saying. We're talking about contributions. There's all sorts of different contributions that we make to a disease. Perhaps some of it may be involved with the way we eat and the foods that we choose to eat. There might be other lifestyle things that we've talked about in the past here, and I know you've talked about this on the program as well. I mean, whether we're talking about smoking or some of the things that we're doing to challenge our health. This is one more health challenge that's significant. So your doctor will be aware, but in order to be able to really understand what's going on within the mouth and on the teeth, then it takes a well-qualified dentist or perhaps a periodontist to be able to really look at things well, and be able to solve that aspect of your health problem as well as he or she possibly can.
And that's a question, because I know we've spent a lot of time talking about on different radio programs. It's interesting, as a guy who is really very well known for your expertise in doing dental implants. In fact, you're one of the people who kind of maybe originated that long before we would get bombarded with ads on TV and things like that. But you've actually done radio shows and TV shows where you said, hey, not quite so fast. Let's take a look at mouth health first, and we may be able to save teeth. And I'm wondering how much of that approach that you take is beneficial for this thing that we're talking about today, fractured calculus. And again, we're talking with Dr. Lee Sheldon of Solid Bite Dental right here in Melbourne, Florida.
I think there's some assumptions that are sometimes made that may not be correct. And one of those assumptions being that if you have periodontal disease, it can't be treated, or you have periodontal disease and you're eventually going to lose your teeth anyway, so let's get your teeth extracted now. We talked about that in the past, probably even last month. I'm well known for dental implants. We've been doing dental implants here since 1986. Of course, having done implants for that long a period of time, you're going to have a reputation.
Sure.
But we still get a lot of patients' teeth healthy, and a lot of patients who may go to one of those places where all they do is to extract teeth and put in dental implants, and then they come to us for a second opinion, and at least I can say, well, that's a possibility. You could do it that way, but maybe there's another possibility, and that's saving your teeth. And part of saving your teeth is making sure that all of the fractured calculus is no longer there. And if the fractured calculus is no longer there and we have smooth root surface, where the body, and now we don't have bacteria fed into those ulcers instead heal, the pockets get better, and the patient is healthy.
Yeah.
It's a beautiful feeling. I mean, we see patients where we extract all the teeth, put implants in, and put teeth on the implants all at the same time. We do that, but how much more satisfying is it for someone to have his or her own teeth, assuming they're going to be in health, and assuming they look good? How much more satisfying is it for that rather than go through a procedure which essentially, it's a great procedure, don't get me wrong, but it's still a substitute for your natural teeth. It's not the same as your natural teeth.
Okay. So here's a little bit, I would call this an off-roading question, because the conversation we're having kind of sparked this thought. And you kind of are an expert on both sides of the aisle. As a periodontist, you know when it's prudent to save teeth. and you also are quite adept at making sure. In fact, we've talked about this, the importance of a smile and your ability to create a beautiful smile and all those kind of things, because you really are not only an expert on the I guess I would call it the health side, but you're also very, very well known for your ability to do top quality cosmetic dentistry, help people get that smile that they were looking for. But the question that occurs to me as we're having this conversation is there any difference in mouth health between keeping your own teeth and having implants when it comes to this question that we're talking about today, which is could fractured calculus cause you problems down the road in other parts of your health?
Yeah, and it's a very good question. The assumption that we all have is, and believe me, I'm not talking down dental implants. I do dental implants for a living. But the assumption that people have, particularly when you're seeing 30-second or minute television ads, or you're even seeing our magazine, whatever it is,
Sure.
is that everything is perfect and you're never going to have a problem again if you do dental implants. That's not true. It's just not true. But the same disease that caused periodontal disease can cause periimplantitis, which is the same as periodontitis,
Wow.
which is inflammation and loss of bone support for the implant.
Wow, we don't hear about that a lot.
No, you don't. I mean, who's going to advertise that?
Right.
You're not going to talk about that. But at the same, so if there are two basic patients I'll see in my office. One that has severe tooth decay, and one that has severe periodontitis. Those are the two primary reasons people lose teeth.
Wow.
I can do a better, more predictable job saving a person's teeth that has periodontitis and save those teeth for a lifetime than I can for those people who have tooth decay. Tooth decay is miserable. I'm talking about severe decay. I'm not talking about a little filling, but severe decay in all the teeth. That's very, very difficult to save because the tendency for the decay to come back is fairly high. But periodontal disease, once we get that bacteria identified, and it isn't just the calculus, but the calculus is important. Once we get the calculus off, we get the bacteria identified, perhaps use an appropriate antibiotic or another medication in order to be able to get that area healed, it will heal.
Wow.
Now, sometimes you have to do a little bit of gum surgery to do that. Of course, you do. Sometimes the calculus is so deep that you've got to get the calculus out, and the only way you can do that is just to peel the gums back a little bit. But it's far more comfortable, far less invasive than extracting teeth.
Yeah. Well, this is a great conversation that we're having, and this is sparking so many questions. We're going to actually talk about the importance of how you can prevent fractured calculus, this whole topic, in the second half of the show. We're talking about this concept of why fractured calculus is dangerous. And if you were with us in the first part of the program, you come to understand that there's actually bacteria that can come from this challenge of fractured calculus that could lead to an increased risk for everything from cardiovascular disease to stroke to Alzheimer's. There are bacteria that can be linked to pancreatic and esophageal cancer. And I mean, it really sounds like this is something we want to learn how to get under control. And I guess the quality of the people who are helping in the treatment and their skill set and their attention to this detail is probably one of the ways we combat this. Am I saying that the right way?
You're saying I couldn't have said it better myself, Kerry. That's exactly right. Let's talk about this. Let's go into this a little bit more detail, because there are lots of people who have been told, I need root planing. And so the root planing is done. And the question that you might have as a patient is, how do I know the root planing is being done as well as it possibly can be done? How do I know that I don't have fractured calculus? And, of course, you can't examine yourself, so you don't know if you have fractured calculus. And, some of us, as periodontists, we need to do surgery, or we have our little endoscope that we use below the gum line so we can see the fractured calculus and get it off. I mean, there are ways in which periodontists can do that. So as a patient, how can you tell whether you're doing okay? So I'll give you a few hints. Number one, you've got to look at the instrumentation that's there. What is the hygienist using in order to be able to keep to clean the root surfaces off carefully and correctly? And so the first thing is that when we're doing periodontal root planning, we always get the patient numb.
Mm-hmm.
There's no way that we can get down below the gum line and comfortably treat you and effectively treat you at the same time without getting you numb. Oh, I suppose there's the rare exception who says, I can take anything. But let's talk about 99% of the people.
Uh-huh.
They have to get numb in order for us to be able to get below the gum line. Understand that we can only go predictably below the gum line 4 millimeters, maybe 5 millimeters, and that's it. Any farther than that, you need advanced instrumentation to be able to get into those areas and clean them effectively. We've already proven that. There have been a number of studies that were done that showed that hygienists can only get down 4 millimeters below the gum line and effectively clean a root surface off. So if you're dealing with 7 millimeter pockets, for example, the last 3 millimeters, or let's say the hygienist can get down 5 millimeters. The last 2 millimeters, if that's not effectively treated, then you're going to still have a problem of bacteria below the gum line or a fractured calculus below the gum line.
Wow.
So one way is to know how deep are your pockets.
Mm-hmm.
Because if the pockets are any more than 4, maybe 5, you're going to need some advanced instrumentation and perhaps some advanced training in order to be able to do that. Second thing you want to look for, many hygienists who treat this effectively are using hand instruments. You know, the old scaling instruments,
mm-hmm.
not the ultrasonic, although we can use ultrasonics to do a good part of this. But to get the last part of it done, to get that fractured calculus off, you often need hand instruments to be able to do that. And those hand instruments need to be sharp. Those sometimes we'll have a sharpening stone right at the chair. We do. Wow. in our practice. We have the sharpening stone right at the chair in order to be able to make sure that those instruments are continually sharpened. But if not, then the instruments need to be sharpened between patients in order to be able to make sure that they're sharp enough in order to be able to plane that calculus off from the root, and make the root totally smooth.
Wow.
Another thing. All right, so let's assume that all of this is done. And by the way, in a patient who has a severe case, we'll see them from anywhere from 4, 5, or even 6 hours of treatment, usually divided up,
mm-hmm.
in order to be able to take a severe calculus case and get this calculus case taken care of and get the roots completely smooth without calculus. So it's a time-consuming procedure as well.
Wow.
Remember, we talked about last time that we can't minimize this effort. You know, it takes considerable effort and considerable skill to get a root surface clean. We talked about Rebecca last time,
right?
And the challenges that she went through.
And I want to remind you, by the way, that show is available archived on the HelpingSeniorsOfBrevard.org website. You could also find it on Helping Seniors of Brevard YouTube channel and actually our Facebook page. So if you missed the last show and this is got you interested, that's a good place to go to get that. Dr. Sheldon, I had a question. Okay, so we've been talking a good part of this show about fractured calculus. Now, how do I know if this applies to me? How would I know as a person wow, I need to know if this is going on for me?
Well, first of all, the dentist will have identified that you have periodontal disease and you need something, it's called, the euphemistic term is a deep cleaning.
Okay.
You know, deep cleaning, scaling and root planing, they're all synonymous.
Mm-hmm.
The question becomes one of time, skill, and judgment in getting these areas totally clean. So let's assume now that you've gone through the procedure. And I can tell you what we do in our office. So we do the procedure, and the procedure is done in our office. As you know, we use an endoscope, a camera that goes
mm-hmm.
below the gum line, so we can see the root surface and know that we get it clean. After we've done that work, I'll wait 6 weeks
mm-hmm.
and then re-examine the patient. So now I've seen the patient before the treatment, during the treatment, and then we're seeing the patient after the treatment, and we're doing that same periodontal probing examination where we're measuring the pocket depth that we did at that first visit.
Mm-hmm.
What am I looking for? We're looking to make sure that those pockets have shrunk. So if you have a 7-millimeter pocket, we expect that to shrink down to a 3 or a 4, something like that.
Okay.
We expect no bleeding when we probe. There should be no bleeding at all.
Mm-hmm.
So both the pockets should be better, and there shouldn't be any bleeding. It shouldn't hurt to place the probe below the gum line anymore because the gum line is no longer ulcerated. Now it's healed.
Right. Okay.
And so that we can place the probe below the gum line and it's okay. If it's okay, non-bleeding, gum tissue is tough, then the problem has been solved. Doesn't mean that it's solved forever. You're going to have to go back for cleanings every few months to maintain what's already been done. But if the pockets continue, and if the bleeding continues when the hygienist probes below the gum line, and there's still bleeding there, then there's more to be done.
Wow. And actually, that was going to be my question, but I think you kind of answered it. Was how do we know as patients whether that we're gaining on it by having the help that's prescribed for it?
I can tell you what we do in our office. We print out a periodontal chart every time the patient sees us.
Uh-huh.
So the patient can monitor his or her own numbers and see how those numbers are doing.
Ah. So that's good to know. And let's talk about that. Now, you're hearing the radio show today, and you're thinking like, this does sound like something I should investigate. And, I think a lot of times we as patients, we don't necessarily know how to navigate these systems. And it could be with doctors, but it could also be with dentists. Maybe you say, well, I have a general dentist. Do I call Dr. Sheldon about this? Or I don't have a dentist, and I should call Dr. Sheldon about this. How do you tell somebody who might be listening to this and thinking like, I'm interested in seeing if this applies to me because I don't like the sound of some of the ramifications if I don't pay attention to this?
Well, it's true. And if you're seeing a dentist and things are well under control, then there's really no need to see me. Mm-hmm. As long as you're seeing the dentist and you're monitoring the numbers, and the numbers are doing okay, and the gums aren't bleeding when the hygienist probes. And by the way, that's different from the gums aren't bleeding when you brush your teeth.
Mm-hmm.
When you brush your teeth, you're only touching the gum line where the gum joins the tooth. But the ulcerated portion is below the gum line, and that's why it's key when the hygienist probes that there's no bleeding at that time. And so you ask the hygienist, am I bleeding? And the hygienist will say yes or no, or a little bit here, something like that. That will be a clue that maybe we need to go a little bit farther. And of course, as you know, I've been a supporter of helping seniors ever since helping seniors existed,
mm-hmm.
and so helping seniors has always been part of our Solid Bite Gives Back. It's a charitable giving campaign.
Yeah, I was going to ask you to mention that.
Call us and you say, I'm supporting helping seniors, and you just bring in a check for $50 to Helping Seniors of Brevard to get the examination, the x-rays, the CT scan, everything at no charge.
Yeah, and then you'll know. And that's what we've talked about that over and over. What a great thing. Number one, it supports the work of helping seniors. But number two, you're going to have the peace of mind of knowing what's going on from a real expert, not, somebody that really understands what goes on below the gum line, like Dr. Sheldon and your whole team there at Solid Bite Dental. So how do people get in contact with you to set up that appointment?
Jennifer is the one who takes the new patient phone calls. And so if you call, ask for Jennifer. Actually, any of our staff knows about that. So if Jennifer's at lunch, it doesn't mean you can't make an appointment. Just say that you want to come in for a full examination. You're supporting Helping Seniors of Brevard, and we'll know what to do. And our staff will tell you what to do. We'll tell you all the rest.
Good. What's the phone numbers?
It's area code 321-259-8000.
321, you said 259?
259-8000.
So 321-259-8000. Call Dr. Lee Sheldon and talk to Jennifer there in the office and say, hey, I heard about that thing you guys are talking about. I'd like to have my teeth looked at. I want to do the donation to Helping Seniors, and that's it, right? They just write a check, $50 for Helping Seniors, and you guys spend actually quite a bit of time with them to get them set up. So
yeah, actually, when a patient's here, most patients are here for 2 hours of that
Right.
examination visit. Because we want to go over everything from soup to nuts and give you all the options that we think are legitimate.
That's great. Well, thank you, Dr. Sheldon, for sharing with us today. Again, I think if I'm remembering the number correct, and correct me if I don't have it, it's 321-259-8000. And just tell them you heard about it on the Helping Seniors show and you want to do the donation plan. And that's about it for our time today on Helping Seniors Radio. On behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, join us here every Wednesday, 12 noon, on 90.3 FM WEJF for the Helping Seniors radio show. We'll see you next Wednesday.